Dr. Spiggle, can you let our audience know a little bit more about maybe a personal experience regarding prescription drug abuse that you've had over the years? Something that maybe stood out, an impression, or?
Most physicians in primary care every day see patients with back pain. It's one of the most common drivers to the doctor that we have in this country. And they come with expectations that they will leave the office with a prescription for oxycodone or another first order narcotic and a muscle relaxant. It happens that according to the American College of Physician treatment guidelines, based on excellent and in-depth research, that neither does a narcotic help nor does a muscle relaxant help recovery for musculoskeletal low back pain, which most of these problems are. However, the patient is very disappointed if they don't leave the office with those prescriptions.
So they come in with the expectation that the prescription's going to follow that visit.
It does, and quite honestly, most of the time a patient leaves the doctor's office with those two drug types in their hand. This creates a phenomenon which is almost a cultural problem in our country of having a symptom and expecting a pill to cure it. And it's cultural because from day one, as soon as a little child is watching television, imagine what they're seeing. Because we in the United States are the only country that allows direct-to-patient advertising through television and other modalities. Children watch television, so they grow up thinking that if there is a problem, there is a pill for it. That, I think, is one of the very underlying factors in why we have such a problem with unauthorized use of prescription drugs in this country. And a problem we have. During this morning's discussion, almost every person in that room, over 30 people, had personal stories to tell of how unauthorized prescription drugs affected their families. That, of course, has motivated them to try to do something about it. In my personal practice and in my family life, unauthorized prescription usage has been problematic. People die from overdose of prescribed or prescriptioned narcotics, for example. And often the use of prescription drugs, the misuse of prescription drugs, is a gateway to cocaine and other street drugs. So there's no county, no town, no community in the state of West Virginia or elsewhere in this country that is immune to this problem. It's time for us as a community to gather our resources and begin to understand it and develop strategies to meet it.
Can you tell me a little bit about the West Virginia prescription drug program?
This particular seminar has been focusing on people who have prescription drugs and shouldn't have them. The West Virginia RX program, which is Governor Manchin's response for people who can't afford medications and need them. The uninsured in West Virginia who are financially compromised. There are about 300,000 of us in the state. And this is the population group who, when they get sick and they need prescription drugs, they really can't afford it. These are the folks who have to choose between paying for a prescription and paying for groceries or rent or other life's necessities. So what happens here in this population group is that the patient either takes just half a pill or actually walks away from the pharmacy after they find out what the pill costs. And the result is that they live sicker and they die sooner. We know from studies done by the NIH that we can reduce the hospitalization of this population group by some 23%, thereby saving hospitals uncompensated care millions of dollars. So what we have done, working with several of the manufacturers, drug name manufacturers, we have asked them to donate their medicine to a charitable pharmacy located in Charleston, simplify the paperwork to be enrolled in the program, simplify the paperwork for the prescriber to be a part of West Virginia RX, and then let it operate as a mail order pharmacy with a 24-hour turnaround between the prescription that is either electronically or faxed into the pharmacy and same-day shipment. Patient usually gets it the next day. We are on the cusp of really making this work in West Virginia. Now is the time for us to learn about, as a community, to learn about it and to make it work.